When we wear our masks or face coverings, you protect me and I protect you from the spread of COVID-19. But for the best protection against the coronavirus, we must wear and use our masks or cloth face coverings correctly. All persons over age 2 and who can remove their masks themselves should wear one. Before putting on your mask, clean your hands. Your nose and mouth should be covered with no gaps between the mask and your face. Do not touch the mask when wearing it. If you do, clean your hands immediately. Replace your mask when it's damp. Discard disposable masks immediately after use, or wash reusable masks frequently. When removing your mask, do not touch the front. Remove your mask from behind, discard, and immediately wash your hands. Let's protect each other from COVID-19 and wear our masks.
Afternoon, Bermuda, and welcome to members of the media. I'm joined today by the Minister of Health, the Honorable Kim Wilson, who will provide an update to the public on the latest from her ministry. Following that, I'll give an update on matters related to how the government is doing all we can to support persons while reminding us the measures that we all have to do in order to remain safe in light of the coronavirus. First, the Minister of Health will give an update from her ministry and also handle stuff that were mentioned in the Ministry of Health's submissions for the throne speech. Minister?
Thank you. Good afternoon, everyone. There were 811 test results received by the Ministry of Health yesterday, the 9th of November, 2020, and one was positive for COVID-19. This most recent case is classified as imported. They were a returning resident who arrived on the American Airlines Flight 308 from Miami on the 8th of November, who tested positive on their arrival test, having not had a pre-departure test. Bermuda now has 215 total confirmed cases that are positive, and their status is as follows. There are 23 active cases. All were imported, consisting of 10 visitors and 13 returning residents, who are all under public health monitoring. None are hospitalized or in critical care. A total of 183 have fully recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 54 years, and the age range for all of our positive cases is from 7 to 101 years. By race, overall, 47% of the cases were black, 46% are white, and 7% are other or unknown. The average age of all deceased cases is 74, and the age range is 57 to 91 years. The source of all cases is as follows. 104 are imported, 90 are local transmission with a known contact, 21 are local transmission with an unknown contact, or none are under investigation. And Bermuda's country status remains at sporadic cases, and the 7-day average of our real-time reproduction number is less than 1. It has been many months since COVID-19 first gripped the world, and during that time, a few things have become abundantly clear. Human connections is inherent to our being. Family and health are what matters the most, and universal health coverage is a necessity for all. It is on this last point that this government will introduce a Bermuda health plan which will meet that need. While the onset of the global pandemic caused the government to temporarily pause plans for health reform, there remains a commitment to a new integrated healthcare model for Bermuda. This plan will see public and private sectors joining together to improve control of Bermuda's healthcare spend and drive better healthcare outcomes. We believe that by focusing on prevention as well as primary and community care, we will significantly reduce the imbalanced reliance on expensive hospital care. Bermudians endure poor health outcomes despite per capita health spending that is one of the highest in the world. We believe that Bermuda needs to implement a spine of core health services delivered in a manner which is sustainable for our population. The economic shock from coronavirus and the rapid rise of unemployed citizens necessitates expanding the safety net of health services for those who have been left under or uninsured. Supported by necessary funding reforms, Our new integrated system will allow Bermudians to receive treatment when they need it and in the right place, making efficient and coordinated use of our available resources. To be clear, the development and implementation of universal health coverage is a multi-year responsibility. We expect to see many benefits to undertaking these reforms in the coming years, including a shift to a care model based on proactive, preventative, and out-of-hospital services rather than our reactive, high-cost hospital care. Without proactive modifications to the island's healthcare system, projected healthcare expenditure risk overwhelming our economy. If nothing is done, we will see deteriorating healthcare outcomes and overwhelming financial challenges for Bermuda. An aging population means that we will have fewer working adults to pay for the increasing demand of the cost of care. Partly as a result of this and healthcare price inflation, healthcare costs are anticipated to double over the next 20 years. Where no changes are made, hospital expenditure will grow by 16% by 2029 due to an increased need for hospital services by those aged 65 and older. Over 20 years, hospital services expenditure is forecasted to increase by 43%. The challenge of rising demand and challenging demographics faced by our healthcare system requires comprehensive reform. To be successful, we cannot do this work alone or function in decision-making silos. This is why we value building on community partnerships with organizations such as the Bermuda Medical Doctors Association, the island's private insurers, and Bermuda First. Bermuda First is a nonpartisan group comprising community and business leaders who, like this government, believes that Bermuda must have a holistic healthcare system that prioritizes prevention, chronic disease management, and healthcare delivery via primary care with the restructuring of the health system financing. One immediate step being taken to contain costs for consumers involves the establishment of a national drug formulary. In legislation being tabled in the House this session, we will mandate that pharmacies provide pricing information on the most commonly prescribed medications to feed into this formulary. This will permit maximum prices to be set for the most frequently prescribed medications, reducing costs to patients and providing relief to those on fixed incomes. Before I conclude my remarks this evening, I need to echo an advisory that was sent out yesterday on behalf of the Department of Health, who are currently out of the influenza or flu vaccine. This is due to an atypical surge of the vaccine as well as the supply chain disruption due to the cancellation of the British Airways flight. They are advising that all walk-in services for obtaining the flu vaccines for the following weeks are canceled. This was previously scheduled to take place at the Hamilton Health Center. The Department of Health is working to reroute our incoming shipment of the vaccine, which was scheduled to arrive on a British Airways flight later this month. Members of the public are advised that they can still obtain their vaccine from their doctor's office. Stay safe, Bermuda, and remember, I wear a mask to protect you, and you wear a mask to protect me. Thank you.
Thank you, Minister of Health. Members of the public will know that globally we have seen an increase in cases of the coronavirus. Locally, we have seen an increase in imported cases, and we're on the lookout for any possible cases of local transmission. We do not yet have any confirmed cases of local transmission inside of the last 2 months, despite extensive testing of close contacts of imported cases. However, it is foolhardy to think that it may not happen eventually. The minister has stated that the increase in surveillance for the virus in the community, the minister has stated the increase in surveillance for the virus in the community that the government will undertake. But at the end of the day, the best protection against the virus is the community. And as we said on numerous occasions, we must continue to be vigilant. We have had good results and consistent performance when it comes to ensuring that travelers do not lead to local transmission. However, we must still do our part, and that success has largely been because we have done our part by wearing our masks, engaging in good hand hygiene, and making sure that we are incredibly careful when we're indoors, sharing space with people who we do not live with. It is important to note that in many jurisdictions, it was understood that it was not large events that drove the spread of the disease. It was actually a series of small events, people visiting families, people going to small house gatherings, etc. One person can be infected, going to 2 events a night, that just goes and spreads. So it's the simple things that we must continue to be vigilant about. Over the next month, overseas students will return for holidays, and some will return at the end of term. Of course, we recognize the lockdown in the United Kingdom and that there is a British Airways flight that will be carrying a large number of returning residents arriving from England tomorrow. We are asking all Bermudians to be incredibly vigilant to ensure that quarantine rules continue to be strictly followed. We have seen news of coronavirus spikes in many student centers in the United Kingdom. And for those residents that are returning home, it is a reminder to make sure that on your way home, you are especially careful while traveling. Carry your hand sanitizer, keep your distance, wear your mask, and do your best to limit your contact. It is especially important that you're not just keeping this in mind at the airport or on the plane, but on your way to the airport and when you are doing things prior to your departure. The last thing that you want to do is carry the disease back home and infect members of your family. It is critically important that we understand the need to be careful. In addition to the flight from England, we're anticipating several U.S.-based students to return for the holidays, as some U.S. schools are electing to shut down following the Thanksgiving holidays, and many persons may not return. It is important to note that during the last 4 months, the United States was the source of 56% of our imported cases versus 35% from the United Kingdom. And that means that vigilance must be the watchword as we enter this period of returning residents, especially those who are in the high-risk category of students. We must ensure that travelers do not endanger our seniors and other vulnerable people. And we have certainly come too far to allow carelessness to erase or undermine our success in keeping Bermudians relatively COVID-free. Before I move on to close and to take questions from members of the media, you would note, members of the media, that ministers are giving updates on their throne speech commitments, not only this week, but also next week, and that will continue on Thursday, in addition with press conferences next week, Monday, Tuesday, Wednesday, and Thursday, from various ministers of the government. This is to make sure that the public can be informed in detail of the items of which were laid out to the throne speech, and I encourage members of the public to certainly tune in. Finally, in 1918, at the 11th hour on the 11th day of the 11th month, the Allied forces of World War I signed an armistice and declared victory. Tomorrow, like many countries around the world, we will recognize the end of that fighting and honor Bermudians who served and eulogize those who gave their lives while fighting overseas. Unlike every other year, this year COVID-19 has caused the ceremony to be a closed event. Though it will be closed to the public, live coverage will air on the government's Facebook page, and it will be shown throughout the day and remainder of the week on CITV. Accordingly, on behalf of all Bermudians, I offer the families of our Bermudian veterans our humble respect and proud acknowledgement of their sacrifice. We hope and pray your memories and our ceremony are worthy of their courageous and valiant service. With that, I'm happy to take questions from members of the media.
Good evening. Premier or Health Minister, I'm not sure. With news of a vaccine kind of close to coming to fruition, is there any possibility of that vaccine arriving here in Bermuda, and what's the possibility of mandatory vaccine? Has there been any discussions?
Thank you, Trevor, for that question. Let me start by where your second question is with respect to mandatory vaccines, because I know that that's been an issue that's been raised by members of the public previously. Mm-hmm. The government is not prepared to engage in any type of discussions with respect to making a vaccination mandatory. We don't have the power. Well, I shouldn't say we don't have the power. Vaccines now for many childhood illnesses are not mandatory, so there is no consideration for the government to make the COVID-19 vaccination, when it does become available, a mandatory requirement. I can say, however, that with respect to our attempts to secure vaccines, we are using two routes. One is through the COVAX facility that I've spoken about before, which is through PAHU, and they would be providing Bermuda with sufficient quantities, I think, for 25% of our population in the first instance, and then more quantities as they become available and as the need arises. However, as I've also mentioned just a couple weeks ago, through Oxford AstraZeneca through the United Kingdom, the UK has indicated that they will be providing vaccines also to their OTCs when they become available, and they're anticipating that that will be available in December. So we're exploring both avenues so that we'll be able to provide obtain the vaccine. You would have probably heard on the news last night they were speaking about cold chains and the like, and I can say that the Ministry of Health is currently working on that cold chain and in making sure that we have sufficient refrigeration and the like to be able to store those vaccines when they become available.
Thank you. Premier, this question, I guess, was for you. There's much talk about the government's move to pay workers redundancies, pay ahead of time frame laid down by Southampton Princess. Can you tell us the thinking behind this, as the hotel time frame seems to be just around the corner, considering workers have been waiting for a while? And can I add, what is the guarantee? What guarantee does the government have that this cash-stricken workers will pay back the funds on a timely basis, even after receiving funds from the hotel?
Thank you for asking the question. The first instance is, I guess you kind of tied it up at the end, because the government is not paying persons redundancies. I think the Minister of Finance was very clear in his statement last evening, in where he was providing a loan to those persons and working with all partners. And I'm sure and understand that the Minister of Finance is best to certainly elaborate on this point. But the payback will come from development financing, which was set to take place prior to the coronavirus pandemic. So there's certainly a lot more work that has to be done in that aspect. But the fact is that in working with all parties involved, the union and the hotel, it is expected that upon that portion in time that those funds will revert back to Bermuda. I don't believe that after the hotel, after the government has paid funds, loan funds to the employees, that the company will then pay those funds to the employees to ask them to pay it back. I think it will go from the hotel to the government.
Good stuff. Mentioned in the throne speech last week, Friday, about long-term residence certificates and the fact that those guarantees will amount to PRCs. We have to make economic investments in the island, or alternatively invest in the Bermuda Trust Fund. So it appears that the rich have a clear pathway to residency, while the next clause speaks about comprehensive in immigration reform and speaks about a framework for persons to obtain permanent residencies. Could you bring some clarity to this clause? As many recall, the people rejected the precious OPA's plan that indicated pathways to status. It seems somewhat of the same.
Well, I answered this question at a press conference yesterday. I'm certain that the Minister of Labor answered this question at a press conference which was held earlier today, where at lunchtime he went over the initiatives, and I'm happy to answer the question again. In the first instance, residential certificates exist now. They exist now. So in that issue, what the minister has indicated, and the throne speech has indicated, is that residential certificates are not tied in any way, shape, or form to any form of investment into the country. Residential certificates exist now. So there is a view to change the policy to have investments tied to residential certificates as well. That is something in the case. Persons who have ability to access residential certificates are, just as you said, wealthy inside of your question. That is the nature of where they are set up. Those persons are needing to demonstrate substantial means and needing to be able to support themselves without having to work inside the local economy. So by nature, they have a significant net worth already. And the view is, from that aspect, in order to encourage investment into the country, which I think is a good thing and is not a bad thing. And so the government's not going to sit here and wage old ideological battles. We are at a stasis of crisis when it comes to our economy. And when ministers are putting forward progressive policies, I hope that those policies be supported. And I hope and I would encourage the public not to engage in reflexive arguments over this place or that place or where do we go. The fact is that we all have to be in this together, just as we were in the coronavirus, or that we will certainly suffer. On the second portion, where you said a framework for for permanent residency, I would say that you are mischaracterizing what took place in 2016. Let us go back in history. Prior to the election of the former government, it now seems ancient history, that's like 8 years ago, in 2012, there were specific discussions inside of that election campaign, and the former government said that they would not be granting status to people who hold PRCs. That is what they said. Then, in 2016, a day after losing a by-election, they came out with a plan that had no consultation with any person. What the Progressive Labor Party said in our election manifesto, what the Progressive Labor Party said then, was that comprehensive immigration reform in a consultative process must be advanced. That is what this government has done since it was elected. Immigration reform without rancor. Immigration reform on a consultative basis so that we can deal with these matters in the best way possible in a bipartisan fashion so they can support the goals of which we wish to achieve. And so in that case, the Bipartisan Immigration Committee had a number of meetings. There was an immigration working group before that. They made a number of recommendations. Those recommendations will be polished off by the bipartisan committee, sent to the minister, drafted in legislation, and tabled for approval. The people elected this government to move forward on a number of issues, and we're going to push forward on those issues. And not everyone is going to agree with everything of which we're doing. But what we are trying to make sure that we do is ensure that we can build an economy that can take care of the persons who live here and that people can afford to live inside their country. And one of the things that was mentioned inside the throne speech is one of the best ways to attack the cost of living is to make sure that there are more people living and working in Bermuda so that fixed costs can be shared amongst a wider variety of persons. Cost of living is item number one on everyone's agenda. And so our policies are intended to make that situation better. And that is precisely what the throne speech said.
Thank you for the clarification, Premier.
No problem.
Government has announced, my next question, government has announced the formation of the Office of Public Guardians to provide independent service for seniors, children, and vulnerable persons. Has there been any talks with age concerns as they are providing many of these services for seniors, and it seems to be expanding to include many other things outlined on this new office? Will there be more talks with such agencies?
The best person to speak to that will be the Minister of Social Development and Seniors, who will be giving a press conference next week, and you can pose your question then, or if you cannot make it, you can put it in writing. She'll be the best to answer that.
Cheers. Thank you. My last question. Premier, it seems that it seems that was you were featured in the Rugby Classic on the weekend, and as you've been outlining using masks, social distance, and the pictures were circulated with you, with the team, without masks and social distance, very close proximity, and you removed that post.
I'm certain I didn't remove the post.
Comment on
I'm certain I didn't remove the post.
You removed the picture from
What
off
picture?
Your personal post.
Oh, I'm going to go ahead and look on my phone right now.
Can you
Trevor.
comment on there's concerns that the public has brought to my attention?
Oh, I'm happy for the public to bring it to the attention. First of all, it was not the World Rugby Classic, so I want to make sure it was clear. This is the World 10 Series, an event that was able to be held inside of Bermuda. The MPs who were in attendance with me wore our masks for the entire time. Mm-hmm. The players were in a bubble. We were going to present the trophy, and that was when the mask came off for the trophy presentation. Mm-hmm. There was someone with hand sanitizer next to me. I shook hands, hand sanitizer on. hand sanitizer off. There was one picture that was at the end of the event with the persons who were in the bubble who have been tested on numerous times over the past few weeks, as I have been, for participation in those events. So I can understand the concerns of which were raised, certainly in that case and instance, but I can assure you that after the picture was done, the mask went right back on. And there were numerous pictures that were taken before with all of the MPs and numerous pictures that were taken after where we were all wearing our masks.
Good stuff. Thank you for
No
clarifying.
problem.
And
Happy
not
to do
taking
so.
that
But I
one-
do not
that
believe
one
it was
personal.
I don't believe it was removed off my page, but I'm going to look at my phone right now.
Hey, have a look.
Okay, thank you.
Rob, is there any questions? Good evening. So, in terms of the vaccine, that we're hopeful that we can get to Bermuda, is there any indication as to how soon we could be getting that? The UK might be getting an intern with Bermuda.
Our recent correspondence with Public Health England has indicated that they anticipate the Oxford AstraZeneca being made available in December. So we are looking to be able to secure that as early as December.
You mentioned it could provide support for 25% of our population. That was just one of the streams that you were referring to, and if not, how much would the accumulative?
Okay.
be?
We're actually exploring two avenues.
Yeah.
The first avenue is through the COVAX facility through the PAHU, and they've indicated that in the first instance, when that becomes available, that we would be able to get sufficient supplies for up to 25% of our population in the first instance, with more to come thereafter. And then likewise, with respect to Public Health England, they've indicated that they too will be able to provide us with sufficient I want to say approximately 25% in the first instance, and then they will also be able to provide further vaccines in time. There are a requirement to take two, so you'll be administered two, so in essence we'll get 25% for the population.
Okay.
In the first instance, because they are going to
yeah.
continue to provide. They've indicated that they would be providing sufficient vaccines for all of the OTCs for their entire population.
Sure. Okay, thanks.
Mm-hmm.
Have you had any conversations as to how, when we do get the vaccine, they would be prioritized?
Yes, the distribution plan is actually currently being discussed and finalized now at the Ministry of Health, but it would involve healthcare workers as well as the more vulnerable persons in our population in the first instance.
Okay. In terms of the flu vaccine, to what extent did the government anticipate this upsurge in demand for the flu vaccine?
So much so that for the first vaccine that was held, the first Flu Express at the Warwick Post Office, the traffic was backed up all the way to pretty much Paget. We did not expect there to be such an uptake. We were thrilled by it, by all means, because obviously persons got the message that it's important, particularly in days of COVID, to take the flu vaccine, but we didn't expect it to be as high demand as it was. However, again, the critical challenge that we have is, of course, the cancellation of the BA flight. So we are working to try to secure the vaccines through an alternative route.
Has there been recorded as yet an uptick in flu cases?
I don't believe so. Now we're at the time where we would start to see them, but to my knowledge, nothing has been reported to me where there's been an uptake and an increase in flu instances.
Okay. With regards to the closed category jobs that have recently been added to the list of closed category jobs in Bermuda, what is the case? What would be the case, Premier? Sorry, I should have addressed you first, Premier. What would be the case? In one of those closed categories that perhaps there were no Bermudians interested in that category? What happens then?
I can't speak to that specifically. I know that the Minister of Labor held a press conference earlier, which was attended by the Royal Gazette, and I'd ask you to put your comments in writing directly to him on that.
Okay.
I joke with my friends, my family, my cabinet colleagues, that the second time in this job, I'm doing it differently than the first, and I know the Minister of Labor is incredibly competent and can certainly answer that question. So if you go ahead and send that question to him, I'm certain that he will be able to answer that question.
Yeah. One more.
You got a few more there.
the previous lockdown in the UK, there had been supplied some emergency flights. Is that going to be the case this time around?
There have been no conversations and or discussions of any additional flights to be put on, charter and or otherwise, and I don't believe that we're expecting there to be. That was a different situation, certainly then. That situation then was that there were persons, with the pandemic hits that were not able and ready to relocate. The government has been very clear in discouraging non-essential travel, discouraging people from leaving, and so we would hope and expect that people would have their arrangements, but a person should not necessarily expect that the government will step in. Also, clearly, flights to the United States are still flying, and so individuals who wanted to get to Bermuda could certainly find an additional route if they so choose. Of course, they have to then sort out flying from the UK to the US, but that's a different story. With the Bermuda passport, I think it does work.
Okay, great, thanks.
Bermuda Broadcasting, any questions?
Good evening, Premier, Health Minister.
Good evening, Doc.
Continuing with questions on the vaccine, when it arrives in Bermuda, what is going to be the distribution method to the public? Who will be in line first to get it? Will it be free?
The distribution plan actually is being worked on and finalized as we speak. However, it would look to vulnerable persons and persons within the healthcare profession first and foremost. With respect to costs associated with it and so forth, those matters haven't been finalized either.
Okay. Just to follow up, with the vaccine being available shortly, at what point will we be able to get rid of these masks?
Don, I would like to be able to give you a positive answer, but I can't. I think that we need to probably get used to the fact that we will be required to wear masks and physically distance and the like for quite some time, for a considerable amount of time. So I'd suggest that you go buy some fancy masks, because I don't think they're going away anytime soon, unfortunately, notwithstanding the fact that we will potentially have the vaccine very soon.
Okay. It's sad news for all of us.
Absolutely, but you can do the fancy mask, Don.
Yeah.
You know, mask contest.
Yeah, I've had to go out and buy different ones just to accessorize. We've asked this before, Health Minister, but our viewers are still concerned about the lack of pop-up testing in Hamilton. And I know like last week you mentioned occasionally at Paget. Most pop-up facilities are sporadic and only available once every 14 days or even just one every 30 days. The single location operating more than once every 2 weeks is in St. David's, which is not convenient for most people. When will you bring regular pop-up testing back to Hamilton?
The pop-up testing is taking place, testing currently is taking place 5 days, 5 out of 7 days a week. They are scheduled throughout the island. Not everybody is in Hamilton. Mm-hmm. Some people live in God's country and some people live on the other end of the island, the east end. So we do have it spread out in various locations. The fact of the matter is, like I say, it is offered 5 days a week. You know, we're fortunate enough to live in a jurisdiction where we can travel from one end of the island to the other in, short order. So I think that though it may be an inconvenience to some who would prefer to be tested here in Hamilton, the fact is that Paget Marketplace has it once a week, and that's not that far outside of the city.
What would be the possibility with the BA flights not coming in for a month? And this, I mean, there's more than 300 seating capacity on those flights, mm-hmm. that at least for a month that people could do it in town.
Well, the Perot pop-up center, not even a pop-up center, the Perot testing site is just specifically designed for travelers. That's the traveler's place. The reality is that, and I stand to be corrected, but not many of the BA flights have had over 300 people in capacity in any event. But the fact that once that is no longer continued for that period of time that has been announced, we will still continue with the pop-up testing, and we will still continue to have it in various locations throughout the island. Perot's is simply for the travelers that are arriving, and we will continue to have travelers from America, and particularly the Miami flights just come on board too. So we're hoping that we will see an increase in the American visitors coming to Bermuda simply because of the testing regime that we have.
Thank you. Mr. Premier, you've sort of addressed this, but many UK universities end their term on December 4th. Students will not be able to travel home at least until December 11th, and there's quite a few boarding school students who get out the next week. If the UK lockdown is finished by then, what's your advice to families if the UK lockdown is extended over the Christmas period?
I would have no advice except for if there are loved ones that you want to get home, look for alternate ways for them to return back to the island. That's about it. I mean, unfortunately, not all countries have done as well as Bermuda has in managing this virus. We have our benefits of being small. Certainly, I heard your previous question, certainly speaking about increasing of testing and making sure that we have enough testing available. And we're going to continue to do that because we have the capacity and the ability to make that happen. But unfortunately, that's not the case in some countries. So for families that are concerned about that, I would say to plan and have multiple different plans. You might book on British Airways on December 12th and 13th, and I hope, sincerely hope, that British Airways will start flying again after a month's hiatus. That is our desire. We have not been given any indications to the contrary, but there are always possibilities that things may be extended, and so we don't know.
Right, thank you. And my last question for tonight. We are hearing about very slow, or in some cases, no testing happening at the hospital. Health Minister, are you aware of any problems regarding testing at King Edward?
I'm not aware of any testing. I know their policy is to test individuals upon admission, test individuals that are patients upon admission, test patients that are transferring to different wards. They test their own staff as well. You have somebody who works at the hospital behind you feverishly nodding yes. So I'm not aware of that at all. To my knowledge, they're continuing their testing protocols as we've spoken about previously.
All right. Thank you very much.
And one comment from TNN, if you'll permit, Premier.
Absolutely.
Allow me to thank you, first of all, Premier, for directing me to that picture, and I apologize publicly. Don't want it to seem that you were hiding something, so forgive me.
Thank you, Trevor. So you are confirming that the post was not removed.
The post is still, the picture is still up on your status.
Thank you very much. You know full well nowadays, if you delete a photo, that becomes a story. And I'm not trying to have that to be the story.
Yes, sir. Forgive me again.
Understood. No problem. Your apology is great. Accepted. With that, I think that brings us to the end of our questions for this evening. Thank you very much. The Minister of Health and I will be back here again next week, Tuesday at 5:45, with hopefully some more news to share regarding the launch of our COVID app in Bermuda. I wish all persons a very happy holiday tomorrow for Remembrance Day. Remember to stay safe. And if you're making your way to National Stadium, to take into account the football that will take place at National Stadium, and best of luck to both teams. It'll be a difficult match for me to watch myself, but I wish everyone to enjoy their holiday and take care. So thank you, Bermuda, and good evening.